I'm Dr. Mathews, a member of the medical staff at Princeton Medical Center. Today, I'm going to discuss uterine fibroids, a common condition that affects up to 80% of American women, according to the American College of Obstetrics and Gynecology. I'll review signs and symptoms and discuss several treatment options. So what are uterine fibroids? Fibroids are benign or non-cancerous tumors that form in the muscular portion of the uterus, and they can vary in size, shape, and location. They can be as small as a seed or as large as a grapefruit, and they can grow inside the uterus, on its outer surface, or within the muscle wall. Some fibroids are attached by a stem-like structure on the surface. And although they are considered benign, fibroids can still cause problems, ranging from pain and irregular bleeding to infertility. A woman may have just one, or she may have multiple fibroids, and not all cause symptoms. In many instances, fibroids are first detected during a routine pelvic exam. The rate of growth also varies. Some fibroids may grow slowly and stay the same size for years. Others grow quite rapidly. Some may shrink on their own, and others may disappear after pregnancy or menopause. It's unclear what causes uterine fibroids, but certain factors may increase the risk for their development, including age. Fibroids are most common in women in their 30s and 40s, though they can occur at any age. Race. African American women are more likely to develop fibroids than women of other backgrounds. Family history of fibroids. Early onset of menstruation, obesity, a diet high in red meat and low in green vegetables, and alcohol use. Many women who have fibroids are concerned that they may become cancerous. Fibroid tumors do not become cancer. There are cancers that resemble fibroids, but these are very rare. Also, having fibroids doesn't increase the risk of getting other types of cancer. Not all women with fibroids will have symptoms, and the symptoms can vary widely from person to person. A woman with multiple fibroids may not have any signs at all, while another with just one may experience debilitating symptoms. Common symptoms of fibroids include heavy menstrual bleeding, irregular bleeding, prolonged periods, pain or pressure in the pelvic region, nausea, frequent urination and difficulty emptying your bladder, constipation, low back, or leg pain. When fibroids cause heavy bleeding, they can increase the risk for anemia. In rare instances, fibroids may also cause infertility and interfere with a woman's ability to achieve or maintain a pregnancy. The first step to diagnose fibroids is a pelvic exam, which is usually followed by an ultrasound to see where the tumors are growing. Other imaging tests, such as a saline sonogram and an MRI, can also help determine the precise location of fibroids. Your doctor will prescribe the tests that they feel are necessary to give you a complete diagnosis and determine next steps for treatment. Treatment for fibroids largely depends on the severity of symptoms and the patient's goals. Options range from doing nothing to medical management with birth control pills or other hormonal medications, or opting for surgery. The surgical removal of fibroids is called myomectomy, a procedure that leaves the uterus in place to preserve the ability to have children. While fibroids do not regrow after being removed, new ones can develop, and more surgery may be necessary. For women who no longer plan to have children, a hysterectomy, the surgical removal of the uterus, may be an option. At Princeton Medical Center, both myomectomy and hysterectomy can often be performed laparoscopically through just a few small incisions. Generally speaking, the appropriate procedure is chosen depending on where the fibroid sits in the uterus. For patients who have growths that are inside the uterus, we are able to use a scope that goes through the vagina into the uterus and scoops out the fibroid. For women who have a fibroid that's pushing from the outside in, we remove the growth using the minimally invasive Da Vinci Xi surgical system. The Da Vinci system enables surgeons to perform complex gynecologic surgeries with greater precision and control, minimizing the pain and risk associated with large incisions while increasing the likelihood of positive clinical outcomes. During the procedure, the surgeon makes 3 to 4 small incisions in the abdomen that are typically less than half an inch in size, which means less scarring and a lower risk of infection. This is a same-day surgery, which means after a short period of recovery, you can go home and rest comfortably. And most patients have very little pain. That's easily managed with ibuprofen or Tylenol. After surgery, your doctor will recommend that you limit your activity for at least 2 weeks. Most patients are back to work and their usual activities by 4 weeks. The only longer-term restriction is to avoid lifting anything heavier than 10 pounds for 6 weeks, because there is a small risk of developing a hernia. For women with a significant number of fibroids, open surgery may be necessary. You should discuss your plans for a future pregnancy with your doctor. If you do plan to have a child in the future, the fibroids can likely be removed in a way that preserves your uterus. Women who don't want to carry a pregnancy may be better suited for a minimally invasive hysterectomy, where the uterus is removed along with the fibroid. It's important to note that having a hysterectomy does not require removing the ovaries too. Typically, the ovaries can remain in place, so early menopause can be avoided. Fibroids can significantly affect a woman's quality of life. You and your doctor can work together to decide which treatment plan is best for you. If you're experiencing symptoms, see your gynecologist for diagnosis and to discuss a treatment plan that best meets your goals.